Hi everybody, it's Stacy. So I haven't posted in a little while. I kind of took a little break from everything I was doing for a while there. But since it's sort of the tail end of National Infertility Awareness Week, I thought I would do a post sort of on the issue of infertility. Um, I feel like it's an issue that, we should think about more often, when we're asking people if they have kids, if we're, when people get married, people start bugging you, well, when are you gonna have kids? So how come you don't have kids yet? And I feel like people don't realize how big of an issue that infertility is now. I feel like it's probably always been fairly common, but people didn't talk about it. I think past generations, infertility is one of those things that people kind of kept to themselves. I feel like maybe women were ashamed or embarrassed about it. I know I was pretty embarrassed about it. Every time someone would ask me, why don't you have kids, or how old are your kids, assuming that I'm married, so I should have kids. And I didn't I didn't know how to answer those questions. And in my profession, people ask you questions about your life all the time, and you kind of ask your patients, how's it going, how's life, and they do the same to you. And it comes up that you're married and people want to know about your family and if you have kids and why you don't or when you're going to have them. And, in your working or in your professional situation, you don't really want to dive into your issues. So you kind of try and find a generic answer to give people to appease them and without drawing attention to yourself. But I feel, for me personally, every time someone asks me, why don't you have kids? Are you going to have kids? Do you want kids? I crawled into this little shell and was just like, yeah, I want kids. But inside of me, everything is screaming, yes, I want kids. I'd have them by now. I am desperate to be a mom. But, people don't see that. And so I guess I'm just doing the post to talk about it, raise awareness about it. It's out there. I'm not shy about it anymore. And I don't think we should be. I don't think we should be ashamed. I don't think we should be embarrassed. And I think that women need to know that there's support out there, whether that's, through your family or friends, which I mean, may or may not be helpful. I talk about it to certain people or to, or when it sort of comes up, and sometimes I find it helpful and sometimes I don't. But no one can really truly help you or truly understand you unless they have some sort of idea of what it's like. And it's not the people that, tried for 3 months and were down because they didn't get pregnant. Those people can't really understand you when it's month after month and year after year of trying and disappointment and sadness and depression and tears and everything. So I'll share my story quick, sort of an abbreviated version, and I'll encourage you guys to do the same. And if anyone needs any support, there's so many of us out there on the internet that care, and it, coming together really helps us to deal with it. I also think that I'm a huge advocate for adoption and, as well as, IVF and infertility stuff and all that sort of thing. But I think that, there's a huge stigma out there. Oh, you're adopted, you're infertile. And I think that, I mean, maybe it's because I deal with the infertility issues, but I've always wanted to adopt, and that's probably a topic for another day. But I don't know, like, I guess when people see you as infertile, it's like, well, just adopt. And as much as I love adoption, and I think we should all adopt whether we're infertile or not, um, people can be really insensitive, I think. And so I guess acknowledging the insensitivities of others and, not being angry with others because of it, because people don't know about infertility. They don't know, a lot of people don't even know what IVF is. They don't know, what people go through to try and have a family sometimes and how hard that can be. So I hope this helps somebody realize that, everyone's story is different. Your infertility situation may not be the same as mine, but in the end, it hurts. That's basically it. In the end, it hurts, and we all need some sort of support. So, my story, I guess, starts when I first got married. We started trying to have children right away. And we wanted kids right away. You know, we both knew we really wanted a family, wanted lots of kids, and we didn't want to wait. So as soon as we got married, we started trying. And I gave it a whole year before I really started to worry about anything, because, I was like, well, I'm young and I'm healthy and I don't see how this wouldn't work. Even though part of me, inside of me, always felt like I was going to have issues. And maybe that's because I grew up having so much pain, and experienced a lot of things that, were causing me to miss school when I was a teenager all the time. Yeah, so I don't know, maybe there was just the part of me inside that felt like, something doesn't really feel right in my body. But anyways, I gave it a whole year. Nothing happened. My cycles are really irregular, so I figured there was many times when I thought I could have been pregnant and I wasn't. So that was a little bit disappointing. But, I wasn't going to be one of those people that, got really upset over it. Because, I mean, some people it takes a month, some people it takes a year. It depends on the person. But after that, I was like, well, maybe we moved. And I was like, well, when we move, we get to where we're going, we get settled, I'll go to the doctor and I'll see. So I went to the doctor, and I talked about my past history of the pain and this and that other thing. And it was always thought since I was 16, that I had endometriosis. We always just kind of treated me like I had it because I had so much pain and so many symptoms of it. But I went to the doctor and I started Clomid and metformin to try and keep things regular and allow me to ovulate, because we weren't sure if I was. It kind of looked like I was with the blood work and stuff, but we weren't really certain. But I did that for a year. I did like 12 cycles at least of Clomid every month. And you get your hopes up because you're like, well, I'm taking this medication. It's supposed to work. So this month is going to be the month. And I tried the charting. I tried the temping. I eventually gave that up because I was like, no, I don't really want to obsess over it as much. But anyways, that's a whole year, every single month of counting your days, counting your cycle, disappointment every single time. So that was really hard. After that didn't work. Fertility specialist, lab diagnosed endometriosis, looking into the polycystic ovaries. Everyone said, let's just go straight to IVF because, there's no point. It's the most likely to work. So that's what we did. We didn't bother with the IUIs. Didn't want that much more disappointment. Just wanted to spend the money, go for our goal, which was having a family. So that's what we did. We went to IVF. We did it. It worked. First try, it worked, and it was wonderful. I have never been so happy in my life. 8 weeks, saw the heartbeat, saw the baby, everything looked beautiful. We transferred 2 embryos, but 1 took. We were happy. We were pregnant. We waited till 11 weeks to say anything to anybody. Then we posted it, and we were really excited. And my 13-week ultrasound, we found out our baby had no heartbeat anymore. The baby had grown, but it was just in there, and somewhere along the way it was a miscarriage. So I had D&C, had that taken care of. Sad for a while, but then, me being me, dusted myself off and decided, we're going to do it again. Did a frozen cycle around Christmas time, failed. So right now we're in our final frozen cycle with our final embryo, our little miracle we're hoping. But yeah, so it's been almost 5 years of this. So I mean, things take time and things take a while, and it's a lot of disappointment. But in the end, I'm hoping that there will be something happy in the end, something to really look forward to it. But for those who have experienced miscarriage, have experienced all the disappointment and the sadness, there's others out there, and we're there to support you, we're there to encourage you, and we're there to pray for you and hope for you, and know that there's someone else out there. So I guess the point of this post, and the hoping what you all take away, is that you don't have to be shy about it. I know that I can be quite blunt about it, depending on my mood and how I'm feeling, I guess, when someone asks one of those questions. And you know what? People are going to be insensitive. So the point of this post isn't to say, don't ever ask someone if they're going to have kids. Don't ever treat people and walk on eggshells with everyone you meet. Treat them sensitively. Because, I mean, yeah, it would be great if people didn't say things that hurt our feelings. If we didn't crawl inside our shell every single time someone asked us why we don't have kids. That would be wonderful. But realistically, it's not going to happen. And people don't mean anything by it when they say something like that. So, try not to let it get to you. I mean, there's going to be days when you're walking through the grocery store and every baby you see and every pregnant woman you see just makes you want to cry, and that's okay. So I guess the point of the post is to say that's okay. Be sad, cry sometimes, but don't let it destroy your life. Live and look forward to things, and see what life gives you. And if you need someone to talk to, reach out. There's all of us out there going through it. I have days when I need to watch other people's videos and leave messages and comments to other people because it's hard for me too. And I'm really hoping that, one day we just resolve all these things. But I'm really thankful for IVF, and I'm really thankful for science, and I'm really thankful for all the opportunities we have that we didn't have back in the day. But yeah, so, hopefully I can encourage a few of you out there to find support that you need. And I don't know, I'm hopeful for us all. But anyways, I hope this post helps somebody. And at least make people aware that, it's more common than you think, and it exists, and there's support out there. But anyways, I'll post later, and I hope you all have a great day.